So we've just, can you hear me okay? So we've just kind of stumbled out on stage, looking at the lights, wondering what's happening. So if you're wondering what's happening, this is the Nourishing Ourselves, Nourishing the Planet session. My name is Lawrence Haddad. I'm the Executive Director of the Global Alliance for Improved Nutrition. We've got a fantastic panel with you for you today. And we have Soumya on the line. Welcome, Soumya. So the title of the session, as I said, Nourishing Ourselves, Nourishing the Planet. The title itself shows you the futility of trying to separate those two issues out. How can we nourish ourselves if we don't nourish the planet? And yet that's exactly what we've been trying to do for the last 50 or 60 years, is separate out these two issues. And I'm as guilty of this as anyone else. When I first joined GAIN about 7 years ago, one of my staff members said, why aren't we doing more on the environment? And I said, look, it's pretty hard just to move the needle on nutrition. Let's figure that out first and then move the needle on environment. And I have to say, my colleague at GAIN was completely right and I was completely wrong. So for the last 5 years, we've been on a mission to try to bring these two issues together, because by bringing them together, we feel like we can accelerate both faster than we could if we kept them separate. Now, the UN Food System Summit a couple of years ago brought all these 5 different communities together: hunger and nutrition, environment, resilience, livelihoods, and climate. And it kind of drew this veil back between these 5 communities. And we found out that we were sitting side by side, all working on food systems and all doing pretty much the same thing. So luckily, we now have massive opportunities to integrate. Are we seizing those opportunities to integrate and to try to drive more than one goal at the same time through food systems? Well, on climate and nutrition, the answer is no. GAIN, together with FAO, WHO, the Scaling Up Nutrition Movement, and the UN Nutrition, we've just published a report that just is coming out tomorrow at CFS in Rome, and it's looking at the opportunities for integrated action. And the news is not good. Let me give you some examples. Only about 5% of the commitments the governments, donors, and agencies make on nutrition, as monitored by the Global Nutrition Report, only 5% of them say anything about sustainability and climate. Only 3% of the Green Climate Fund grants of the last 2 years have anything to do with nutrition. Only 1% of ODA, the Overseas Development Assistance, that goes to climate has anything to do with nutrition. Very few, only 2% of the nationally defined contributions, the NDCs, that are essentially the roadmap to lowering emissions, only 2% of those say anything about nutrition. And as for the private sector, no companies, none of the 350 agri-food companies that the World Benchmarking Alliance regularly surveys, none of them score well on nutrition and score well on sustainability. So these two worlds seem fairly separate. And our job today is to say, how do we increase the opportunities for integration? And actually, what do those win-win solutions really, really look like? So we have a fantastic panel for you. Let me just briefly introduce them. Krista here. Krista Harden is the President and CEO of the US Dairy Export Council. And Krista spent 7 years as well working with Secretary Tom Vilsack at USDA. What a fantastic speech he gave this afternoon. Nearly 3 of those years with Tom as Deputy Secretary. Then we have Geraldine Mukashimana. Geraldine is the Vice President of the International Fund for Agricultural Development, IFAD, and she previously served as Minister of Agriculture and Animal Resources for the Republic of Rwanda. Was the minister for 9 years. Dr. Soumya Swaminathan, who joins us remotely, is the current chairperson of the MS Swaminathan Research Foundation and previously served as chief scientist at the World Health Organization. And Dr. Sumya, all our condolences to you for the passing of your late father. He was an amazing person, a real mentor for me and so many others. His intellect, his humanity, and his humility were inspiring. And then Jim Suter. Jim is the CEO of the US Soybean Export Council and has worked on behalf of the US agricultural industry for more than 35 years. So I'm going to ask each of the panelists a question. They've seen the question. If they answer in less than their allotted time, we'll have time for a bit of Q&A. No pressure, panelists. So Krista, the US Dairy Export Council's mission is to enhance the demand for US dairy products and ingredients in overseas markets. It does what it says on the tin. But dairy is often one of the really big wedge issues in attempting to nourish people and planet. Often the nutrition folks in the global south are trying to increase the consumption of dairy for groups that are very vulnerable to malnutrition. Infants, young children, adolescent girls, young women, pregnant and lactating women. While the environmentalists in the global north are trying to reduce dairy consumption to reduce emissions. And often these groups are at odds with each other, but do they need to be if we inject a bit more nuance into the debate? What is the Dairy Council? How does the Dairy Council find itself? Do you find yourself in the middle of these debates, and how do you handle them?
That is a loaded question, and
it
yes,
was.
one
Totally
word,
loaded.
yes, I could stop right there and say yes, we are in the middle. But the longer answer would be that, and I think you studied it very, very well earlier, we have to make both a priority, good for people, good for planet. It's not either or. I think for generations, it was possibly good for people, then maybe, hopefully it's good for planet, or we assumed it was. So I think dairy farmers in the US, and I'll start there, although I will talk about global dairy as well. The US dairy industry has made great strides over the last many years, producing more, but with less land, less water, and continuing to lower our emissions. Commitment from the dairy farmers themselves through science, research, genetics, innovations, technologies, continuing that path, knowing that even though we have made great strides, there's still more to do, and we take that responsibility. I helped the industry set goals for 2050 to be GHG neutral by then. I'm also maximizing water use, and I think water may be the issue we don't talk enough about, frankly, and I think it will over time, but there are others, packaging, there's many issues, right? We have to focus on all of them at the same time. But if you listen to, if you believe the UN FAO, they say that global dairy production is less than 3% of GHG emissions. So if you did away with all of the dairies in the world and you didn't, how would you would still have environmental challenges and issues, even without dairy. How do you make up the nourishing calories? And the Secretary said it good today, it's not just about calories, it's not just about feeding people, we have to be talking about nourishing people. And what resources would it take, natural resources, to replace, I should say, what dairy actually brings to the table? So it cannot be an all or nothing. I think that's an easy, maybe simple way to look at it. Dairy needs to be part of the diet. In many, many economies around the world, if you own a dairy cow, you can feed your family and maybe somebody else's. It's a large employer, it's a large equalizer, it's a big part of nutrition. So what we would challenge is we need to be working together to find those solutions to make sure that dairy is available. It's available in various forms by producers across the globe, but also with the latest technologies, the latest innovations to make sure that it's not just good for people, but good for planet. Finding that balance, I think all of us will talk about balance a good bit. These are complicated issues, they're complex issues, and the solutions are going to be the same.
Thanks, Krista. I mean, we're all trying to balance. Food systems offer us this tantalizing prospect of trying to balance these outcomes of livelihoods, resilience, environment, climate, and hunger and nutrition. And I'm so glad you mentioned the fact that environment is not just climate.
Right.
Because so often that's the shortcut for environment. But if you look at any of the reports and you look at the profile of food production of different food groups, they have very different profiles, not just on emissions,
right,
but on water use, on energy use, on nitrogen cycles, on phosphorus cycles, you name it. It's much more complex than
it is.
than
And holistic approach. We have to,
holistic.
yes.
So thank you. Geraldine, when you were Minister for Agriculture and Animal Resources, you must have thought really long and hard about how farmers can address nutrition and environment and still generate what Secretary of State Vilsack said is ultimately the bottom line, because farmers are business, women and men. Now you're at IFAD. What support do you think development partners like IFAD and others need to put in place to help crop and animal source producers achieve these three goals?
Yeah, thank you. It's really important that we understand that nutrition, livelihoods, and environmental sustainability are tightly linked, that it gets difficult to tease them apart. And as a former minister, as you mentioned, it was really hard to tell people nutrition while they don't have any penny into their pocket, and it's hard to tell them environmental sustainability while their kids are hungry. So all of these things, at the end of the day, they come together. But now that I'm at the fund, I look at what IFAD does, and it's not totally different from what I was doing, because at the end of the day, what we need is that the farmers, the small-scale farmers that I was working with, that I'm working with today, they really need to have the knowledge, the technical capacity to know how to deal with these linked aspects. And it's been a challenge, and I feel that to make sure that they know what to grow, when to grow it, how is it affecting the nutritional outcomes, it's something that the world needs to keep working on that. I mean, sometimes having produced sufficient food doesn't even mean that they are going to be consumed at home. So the technical assistance, the capacity building to make sure that the people that we work with, that we serve, are knowing what is nutritious, how does it get prepared. We used to work with the farmers who would produce all the milk and sell it, and then the kids are going to be stunted or hungry. So the capacity building, the awareness building becomes an important aspect, but I'm glad that IFAD is still working on that. We really work with various people. We host the Farmers Forum. We host Indigenous People Forum. We host the land consolidation aspects to make sure that we are hearing from the people we serve, so that we can design programs that are responding to their need. But again, a second one that I feel is really needed is, again, working on the fund, money, money, money. There is no enough finance out there. As you mentioned, only 3% of the public climate finance goes into the food systems, and only 2% of the climate finance reach the small-scale farmers. So that means there is no money out there that is going there to address the issues that we care about. There are no money to address environmental, sustainability in a rural farming community. There is no money to make sure that the farmers are producing and eating nutritious food. And without that, there is no income for farmers. So it's really all the time see it as a circle that is coming back together. And again, if I'd work in those 3 areas, we make sure that at least minimum 60% of the projects that we finance are having nutritional outcomes. And we make sure that 90% of the projects we finance are addressing environmental aspects. But we still believe that is not really sufficient. Another element that is linked to that is how we support our small-scale farmers to adapt to climate change. The farming communities are heavily, especially the small-scale farmers into the global south, is heavily affected by the climate change, but they have a tiny minimum contribution to that, but they get hit the hardest. So if I again try to work on that, and we have been working with different donors to mainstream climate finance into our interventions, and we have a program that is called Small Agriculture Adaptation for Smallholder Agriculture Program, and we are mobilizing around 500 million to make sure that we can mainstream climate finance into our interventions. Something that is there to help, but again, that I believe is not reaching the rural farming communities in the global south, is the innovation and technology. There are some technological solutions out there, so making sure that they reach the end users who are the most needing them is really critical. And I think the last point is being IFAD, being anyone, we are not going to get there if we are not working together. So collaboration, working together, partnership, this is an area where they are mostly needed.
Thank you, Geraldine. I mean, you mentioned income. Farm families have to have enough money to buy, to be able to consume the foods they produce rather than have to sell them for the income. If you're producing healthy foods, but you can't afford to consume them, that's a bit of a problem. You also mentioned finance. Again, are our financial systems set up to actually address these multiple outcomes, the nutrition, environment, and livelihoods, or are they just designed to maximize the output of staples, for example? And you mentioned partnership, which is so key. If you want to bring these different outcomes together, when you design your projects on environment and nutrition, I'm sure you have a community of people you can draw on to help those. And then you also mentioned innovation and how important that is to bring these different outcomes and communities together. On the point around demand, because a lot of this is, there has to be a demand for these products, that these more nutritious products that are less burdensome on the environment. Someone's got to pay for them, be willing to pay for them. If the market doesn't pay, what's the role of public procurement? Let me go back to your Rwanda days. Governments are big purchasers of food. How practical is it that governments can do a bit more? We did this report I mentioned earlier. It went through the public procurement policies of about 70 countries. And not many talked about nutrition. Rwanda's one of them, it does. And not many of them, even less of them, talked about climate and sustainability. What's the role? It sounds good, but is it practical?
It depends on the situation. I know my government has been working on that because we have stunting issues to address, and the government of Rwanda has partnered with Africa Improved Foods, and I was a minister by then when we were striking that deal, and we made a purchasing agreement of nutritious foods that we have been distributing to pregnant and lactating mother and babies. And it's also procuring some foods for the school meals, but that is a public role when you are dealing with the emergency situation that you want to address, and you don't even have the people, the citizens who are capable to buy for themselves. So when I was leaving the ministry, I was having an argument with Africa Improve the Food, telling them, you guys have made this line that is meant for government purchases and so on. Why aren't you making an extra line that is producing affordable, nutritious foods, so that us, the general public, whenever we go to the open market, we go to the store, we can be able to purchase for ourselves. So to me, I believe that having farmers, having citizens with purchasing power so that they can be able to purchase the nutritious food is key. Mm-hmm. But saying that, I know that we still have countries that are having a long way to go to be able to do that. But again, having a people-centered leadership is very key so that you can be able to build the capacity for them in the future to do that.
I think Rasha talked earlier today about the importance of safety nets and public procurement for different safety nets. And I think governments always have to be in the lead, but essentially the private sector is the food system. So if governments can set the tone about purchasing a certain type of foods, that really sends strong signals to the private sector about what to do and what matters.
I guess when we were doing that back when I was a minister, was also building the awareness and the capacity so that people can be able to understand there is a certain food that can respond to the challenge at hand. So you assume that with time also they can take the lead.
Cool. We were talking a lot about proteins this afternoon, but it's also the micronutrients that are also very, very key for growth. Sumya, I want to turn to you. Thank you for joining us remotely. You're a medical doctor, Sumya, and you are the chief scientist at WHO. And we know nutrition is achieved through the interplay of diet and good health. And so health systems are just as important for delivering nutrition as food systems. What do you see as the main pressure points that are placed on health systems by the climate crisis? And how do they hinder the ability to deliver nutrition interventions through the health systems? And what can we do to make health systems more resilient to climate change? Over to you.
Thank you very much, Lawrence. I hope you can hear me all right.
Perfect.
So I think this is a very important question, but also very difficult because, as you know, nutrition, when we talk about nutrition, it's really multi-sectoral. And yes, I mean, the health system ultimately sees the end results of all of our action and policies on nutrition, because ultimately it's the human being that's impacted. And we see that both at both ends of the spectrum now, and what the data is showing us. Of course, we know that, you know, when we see the 2023 report of how the world is doing as far as the 2030 agenda is concerned, we know that the world is mostly off track, and especially when we look at commitments to hunger, poverty, nutrition, health, and climate action. And so there's more and more urgency, I think, to think about these things very synergistically. And as you know, we're getting closer to COP28, we really need to think about where are the synergies, the co-benefits in particular, but also the trade-offs between action on climate and action on the SDGs. And we've got to accelerate. We've got to put more financing, more energy, more collaborative work inputs into those particularly areas where there are lots of co-benefits. And there was a recent report that I was a part of that looked at the intersection between action on climate, action on SDGs, and how we can accelerate. Coming back to the health system, as you know, the pandemic was a huge shock to the entire world. And I can say that probably with the exception of a few countries, we realized that most countries' health systems were not resilient to absorb the kind of a shock that pandemic posed, and discovered that the investments, particularly in public health and primary health care, were lacking even in high-income countries. And in fact, some of the lowest income countries that had invested in primary health care and that had not had the resources really to build, very high-tech big hospitals, they were the ones who actually did better, because it was a community connect, the community health workers that were used to going into the communities and talking about malaria and talking to women and about keeping their children safe and how to prevent vector-borne diseases, nutritional advice, and so on, actually did better. So I think the lessons that we learned from the pandemic is really about investing in resilient health systems, investing in primary health care. And not only that, it put a lot of focus, I think, on the preventive aspects of health that we often forget or take for granted. And most governments, when they health ministries, are really ministries of disease or ministries of sickness. They are not ministries of wellness. And so I think a couple of things, when you take a step back and say, well, health is about prevention, about promotion, health promotion, and then, of course, also about managing people with disease. And we know the non-communicable diseases are clearly linked with diet and nutrition. Dietary risks today, I think, globally are the #1 risk to health, driving both undernutrition, stunting, wasting. That's unfortunately increasing today in the world with food insecurity in many, many parts of the world, also because of all the conflict that we're seeing. But on the other end of the spectrum, also leading to obesity, hypertension, diabetes, and so on. And those diseases really impose a lot of costs on the health system, because you have people who end up with kidney disease, with heart attacks, with strokes, and those are the ones that actually need high-tech hospital interventions if people have to survive. And we're seeing the gap in life expectancy in people who have a cardiovascular event that live in a low-income country and a high-income country because of the difference in access to health services. So really our goal should be to prevent people from developing those complications by tending to the main determinants and risk factors. So I think the health system really needs to invest in primary health care and the workforce. We know that we have a big gap in health workforce, 18 million health workers needed by 2025. There's a gap there, and a lot of health workers are now leaving health, unfortunately, healthcare, because of the burnout, but also to invest as a steward for health. And this is where I think the health ministries need to become advocates and stewards for health in terms of driving agricultural policies, in terms of really working with the colleagues in agriculture, saying, look, we need a nutrition-sensitive agricultural system. This is the track that our country is on. This is the profile of the nutritional maladies that we face, and where are those interventions and policies? Similarly, being a champion and a steward for action on air pollution. That's another big driver of ill health worldwide. Through regulation, through food labeling, for example. I was in Singapore recently and see that they have made significant reduction in the sugar content of what's being sold, both beverages as well as foods, by regulation and by implementing a front of pack labeling. Similarly, school meals and so on. So I think the point I'm trying to make is, on the one hand, you need to invest in health systems to be able to prevent disease, to be able to manage people who come with non-communicable diseases, so early detection. Health workers need to be trained in nutritional counseling. I think, again, there are big gaps here that we work in silos. There's very little nutrition education of medical people and healthcare workers and nurses. So I think that needs to improve. So more training, capacity building. And then I would also say more research and more focus on data and science, and using data really in a way in which you could actually drive those changes. Again, we collect a lot of data. The healthcare workers and the nutrition workers who are out in the community collect a lot of data and send it up. but how well are we using that data, analyze and then feed that back to those healthcare workers out in the communities to say this is where you need to change. So I think, again, through regulation, through policy, through training, and of course through investing more in our institutions that can do the science and the research contextual to that country. I think those are some of the steps that health systems need to take very urgently.
Thank you, Soumya. I think you've highlighted this dilemma or this issue of, in an era of repeated crises, how do we get away from this kind of doom loop of just always being totally reactive and flip it into, obviously you need to take care of the issues that arise, but flip it into a more of a preventative, holistic perspective. It's not easy. It doesn't work with the politics, does it? No. Jim, soy is a highly nutritious and versatile crop. We know that.
Yep.
We know it provides food in multitudes of ways, from chicken, fish, pork, eggs, to soy and plant-based foods, to heart-healthy oils, amongst other products. Tell us about some of the challenges in making this more sustainable. How are you doing this? And tell us a bit about how you are trying to make these products even more nutritious. And what is the Soybean Export Council doing to support these efforts of the farmers that are your members?
Yeah, great. Thanks for that question, Lawrence. And it's a very interesting challenge that we work on. And if we think about the things that we've heard today and that we're all aware of, but the growing demand for food around the world, the growing demand for protein, and the climate change issues, the SDG lack of progress that we talked about. So when we set that as our stage, it really does create a call to action. But I think there's good news, and I want to try and share a little bit about that, because I think we're very fortunate because our U.S. soy farmers, they feel this shared responsibility to nourish both people and the planet. And I want to give you a few examples of that. But the first one I want to talk about is we have a chairman, Stan Bourne, a farmer from Illinois, and I've heard him give many presentations over the last year. And he talks about that he farms so no child goes hungry. And I think that's a great example of the way that they try to produce nutrition. And then we also have U.S. farmers who multi-generation farms, and one of their main goals is to make that farm so sustainable that it would be passed on to the next generation. So there we have the shared responsibility of creating nourishment and of nourishing the planet as well. So let me talk just about a few things. You mentioned the highly nutritious product, and soy certainly is. It can be used in plant-based foods, in animal foods, in aquaculture foods, and of course the oil.
It can also be used in ultra-processed foods, which are not particularly healthy. So
Which are not particularly healthy.
How do we make it only used for the good stuff?
Yes, so that's a very good question. So our organization, USEC, does a lot of work around the world, working with various organizations. And the first thing we do when we go into a country or when we work with people is try and help them become more efficient in their production. So whether that is aquaculture production, poultry, et cetera, production, we try to teach them the latest technology and the best ways to do that. And I think as people are producing meat products, or if they're producing something like tempeh or tofu, there are ways to do that without it becoming an ultra-processed product. So yes, some soy ingredients do go into ultra-processed products, but I think we can also teach people how to produce the basic good nutritional products that soy drives. As we heard from Secretary Vilsack, there certainly is this demand for protein. It will be growing. So we need to continue to do that. One of the things we also heard about in a program that I am very proud that our organization operates is called the Right to Protein. And this is something that we've been doing for about 4 years now, and started in India and working in other countries, trying to educate, working with nutrition experts, hospitals, doctors in countries, trying to teach about the need for protein, particularly in children. I've heard the word stunting used, the lack of brain development. That comes from protein, so we need to make sure we're working on that. Let me also just shift to this, feeding the world and making sure we're taking care of the world. Our farmers have done a great job adapting all kinds of precision agricultural, no-till farming, things that make sure that they farm and they can pass this farm along to the next generation. To help drive this change, we've created some tools that people around the world can use to signify when a product is sustainable or when it isn't. Because I believe that consumer demand, consumer pull for sustainable products is what we need. Because we heard you have to give sort of an economic incentive, an economic signal to producers so they have that. So we have created these sustainable U.S. soy logo, various things that can be used to signify when a product is produced in this way, so the demand can pull on that and encourage farmers to do more of that. Another thing that we are doing that we're very excited about are soy excellence centers, really trying to also nourish young minds. So going into several different places around the world, working with early stage people who are involved in the protein industry, training them how best practices, taking them the education from land-grant universities here in the U.S., but working in their countries so we can help these people who are just getting started in their careers to understand how to produce products healthily, nutritiously, and efficiently, and hopefully they will become the leaders in the future that are able to do that. So I hope that gives you an idea of the way that the kind of collaboration that's taking place, at least in the minds of our producers, in between both nourishing people and nourishing the world, but also collaboration with many organizations around the world. And that's something we pride ourselves in.
Thank you, Jim. I mean, I like the way you started out your talk by talking about those individual farmers, and that's great, but we can't rely on their goodwill, right? We have to set up incentives that drive it, and the example of the labeling is a really good example of that, and we need more and more of that.
Yes.
So colleagues, we're nearly out of time. Let me ask you each to spend 30 seconds on telling us what can we do to seize more of these generate and seize more of these win-win solutions. Krista, back to you.
I will end where I started, that has to be balance. We have to find the balance between good for people, good for planet. I think decisions have to be science-based, not emotional-based. And farmers have to be at the table. We talk often about what we want them to do, how we want them to do it. We need to have their voices at the table, help them to make decisions. They'll be better.
Yeah. If you're not at the table, you're on the menu, right?
Yeah, that's true. My daddy would tell you that. He's a farmer.
There you go. Thank you, Krista. Geraldine.
I think when we are discussing these things, we tend to send them away. But having a sustainable climate, having people who are well-fed, having people who have income, it's all about us. So it's really important that we don't send these things away, that instead we send them to us. I think if we do that, everyone will do his job or her job.
Thank you, Geraldine. Sumya, over to you.
I think I hope the world has recognized now that health, and of course nutrition drives good health, is central to economic development, and that without a healthy population, no country is going to be able to advance economically. And so I think looking at our policies, and this again is of course a plea to politicians, but also to the public to generate awareness that if we don't look at the drivers of ill health, number one of which are today is poor diet and poor nutrition, is that we're going into this vicious cycle that we're going to be spending more and more, and we will be unhealthy, and of course the planet will be unhealthy. So I think the awareness of those links and also concrete actions, what can each one of us do, what can governments do, but what can individual citizens do as well, is important.
Thank you, Sumya. And that statistic about diet being the #1 driver of ill health globally, it's the same in every country and in every state. I'm doing a talk at Central College in Iowa later this week, and I looked up the Iowa stats, and it's the same for Iowa as well. It's really universal. Jim.
To be successful at meeting the challenge of nutrition for the world and for the people, the planet, we need collaboration. We need continuous improvement, utilizing the best technology and innovation that we can find. And we also need to be careful not to say that trade is bad. I heard Secretary Vilsack point that out, that trade is important. And I think the idea of comparative advantage, allowing each country to do what they're good at, and then to be able to trade allows us to be able to provide nutrition to the people around the world in the most efficient way possible.
Yeah, we were talking about this earlier. It's important to have trade that is fair and not to destroy the domestic markets that you're exporting to make that energy a positive force. And I think it's entirely doable. My own view is don't make the mistake I did for about 25 years and ignore people working in very similar fields to yourselves. Don't always talk to the same people. When you meet them at conferences, talk to people you've never met before and learn about what they're doing. I think most of the innovation in this world comes from lateral thinking and lateral discussions, not unilateral ones. So colleagues, thank you so much for a great panel, and thank you everyone for listening. Please give them a round of applause.